everyone. Good evening, everyone. Welcome you all to the fifth webinar of the webinar series on adolescent and youth. Before we start the webinar, I request the audience to fill the pre-poll, which is being displayed on your screen, till we wait for the other participants to join in. It is also open for the panelists as well. Thank you. Good evening, everyone. I hope everyone has filled the poll. I once again welcome you and my esteemed panelists, Dr. Kapoor, Ms. Aprajita, and Ms. Pooja Bakshi to our fifth webinar of the webinar series on youth and adolescent health. Today's webinar topic is new role of teachers and parents as health educators during and after pandemic. I'm Sharon Augustine, your moderator for today. Few instructions before starting the webinar. Kindly keep the chat box clean. Please do not have unnecessary discussion in the chat box. We tend to miss out the important questions due to it. And we will be taking the questions after the panelists address it. Please drop your question with the name of the panelist in the Q&A box. Thank you. As we start with the webinar, I would like to say, being a public health NGO, and a pioneer in school health program. Sharp NGO has always worked in the field of health, especially promoting both preventive and curative aspect of public health. Through the journey of 21 years of the organization, we have realized that our primary stakeholders who have supported us all through our programs and helped us to reach the to our beneficiaries, that is children, our teachers, are the teachers and the parents. Teachers are always been a guiding spark to us. I remember that 10 years back when I was in school, my teacher used to guide my parents to include nutritious food in my tiffin and avoid junk. And these small tips we carry through our lifetime. And as parents, they are always concerned about their child's health and try to do their best to protect their children from infection and disease. In this pandemic, we have changed a lot. We have experienced a lot of changes around us. Even the role of teachers and the parents have changed in this pandemic. And the question here is now how teachers and parents' role as health educators has changed. To know further about it, I welcome our first panelist, Dr. JP Kapoor. Currently, he is a senior expert in adolescent, child, and newborn health at Bahadur Shastri Hospital. He's a former head of school health program and has also received state award for his meritorious services in public health. We are glad to have you, sir, and really excited to hear from your experience. Over to you, sir.
My pleasure. Dear participants, we are passing through a very difficult phase of corona pandemic. And this corona pandemic is not only the families and its communities which are suffering. The main suffering has gone to our students, our children. We need to work together in this pandemic, in these difficult times, to really tide over this crisis. We need to integrate and systematically work on those issues which are very dear to the students and our children. Studies apart, there are many other issues which we need to work upon to tide over this crisis. The parents and teachers have a very big role to play in this difficult times. To name some of the times, some of the issues where parents and teachers have to play a very big role is, I will come straight to developmental issues first of all. The development of the child is dependent upon exposure, the exploration of the world, which has become limited in this COVID times to their houses. So the development, let it be psychological development, let it be cognitive development, let it be social development, it's all related to the exploration of the world and which has got limited. The other issues which parents and teachers need to talk about them is the dietary habits, where junk food, which was such a thing for them, should be avoided at all costs. Coming to the other issues of physical activity, it's just not corona which we are dealing with. Sitting at home, our children are becoming obese, or I will say malnourished. If you go to the deprived population, they don't have food to eat. I travel to my hospital every day. I saw young girls asking for money on the roadside. So either they are this side of the table or other side of the table. Some of the students or our children are getting obese, doing no physical activity. So we need to focus, teachers as well as my parents, the physical activity. The other most important issues are the health issues. I've already talked about some of the non-communicable diseases like hypertension, diabetes mellitus, getting very high prevalence during these times. And at the same time, we have to think about the infectious diseases and particularly corona. How should we teach? How should we handle our students, our children, so that they don't get this infection from community or from wherever they are living at this moment? Because
Sorry to interrupt you, sir. Could you please speak a little louder?
Okay, sure. So the parents and teachers have a very big role to play in all these issues. I've talked about developmental issues. I've talked about dietary issues. I've talked about physical activities. I've talked about infectious diseases, non-communicable diseases. But let's straight away come to the mental health issues, which is the main issue at the moment, because children are sitting at home, they're not able to get out of their houses, and they're getting anxious, anxiety, the fear
Sorry to
of getting.
interrupt you, sir, again. If you are comfortable, all the audience want to see you. So can you please come on the camera?
I've already done this. Okay, sure. I hope now I'm visible
Thank you,
also.
sir.
I'm sorry. I'm sorry, participants. So I was talking about the role of parents and teacher, and let's come straight to the mental health issues, which are very important at the moment. The fear of corona, the anxiety, not only the students, the family, the anxiety issues with the students are the foremost at the moment. The fear of getting corona. And not only that, because of this fear, the teachers also get that fear, the parents also get that fear, but the students are the main sufferers. Either they are not able to adapt to this atmosphere, new thing which has suddenly happened, and even parents, I will say, they are not even able to adapt to this. And if they don't adapt to this sudden change, sudden stress, then either they will be act out or they will act in. Act out means they will be getting violent at home. I've seen adolescents are already having lot of mood swings, but I'm getting lot of phone call nowadays that these mood swings have really increased a lot during this period of last 5 to 6 months, because they're not able to go out, they're not able to share their emotions with their peers, with their friends, and parents, as usual, are still not available to them. So either they will act out, they will become violent, they will be very labile emotionally, or they will act in, they will go into a type of depression, I will say. They won't talk to anybody, they will remain secluded, not talking to anybody, and even either eating too much, acting out, or eating very less. So all these things need to be taken care of during this pandemic times. So please, I will request all the participants to think about these children who really, this is a time for them to develop. This is a time to develop all those things, to go out, to learn. Ultimately, development happens when we explore the world, when we get exposure to the world. But here is a time when we are getting limited to the four walls of the houses, and we are not able to really get those feedback where we should get that feedback from the people that this is right and this is not wrong. And this brings additional responsibilities now on parents and teachers to take it forward. I'm open to any other thing which you want to ask me. So I will say mental
Thank you.
health issues are key issues at this time. But please don't forget about dietary issues, about physical activity issues, about the emotional issues. The key thing I will say, parents and teachers, please, you adapt to their emotions. They really want to share so many things which they're not able to share with anyone at the moment. They are lost their friends, they're not able to talk to them. And we really have to come forward and participate in sharing their emotions. Please carry on.
Thank you so much for your viewpoints. I really agree with you that there are a lot of even the adolescents are facing a lot of mood swings, and most of them are having depressions, and this all falls upon the parent and the teachers, and it is the role of the teacher and the parents to guide them during this situation. Thank you so much for all the points which you have discussed. Thank you. Our next panelist for the day is Miss Aprajita Gautam. She is president of Delhi Parents Association. She is committed to reinforcing positive feelings and behaviors in children and parents to help them lead a healthier and happier lives, and mentor parents and family members to tackle the different situation. I welcome you, ma'am. Hi, ma'am. Can you hear me? Hello, ma'am. I guess there is some connection problem with Miss Aprajita. I would welcome our next panelist for the evening, which is Miss Pooja Bakshi Jaitly. She is counseling psychologist. She has been in the field for more than a decade. She has an experience in working with diverse population of adolescents, both inside and outside of the classroom. The reason for having her here is that she has the first-hand experience working with adolescents. Over to you, ma'am.
Thank you so much. Before starting my session, I would like to say, first of all, are you able to hear me clearly?
Yes, ma'am.
All right, great. Thank you so much. So, good evening, all of you. And thank you so much, sir, for explaining it in a very beautiful way how things have changed and how it is affecting the adolescent and the children and the parents and everyone, in the society right now. I would like to now talk about one part of health which we usually, ignore, or we just, tend to give a miss to it. That is our psychological well being or our mental health. And there are many studies and research which have been done, and they show a very close relation between our psychological well-being and our health. But still we tend to just ignore it, or maybe tend to just keep it under the doors and don't talk about it. But as pandemic is a time where there is a lot of uncertainty, where we don't know what is going to happen in near future, so we tend to get more stressed out and worried, and there's high level of pressure on us. As we are here today to talk about children and adolescents in per se, so I would like to share a few observations which I have made during this pandemic period, so as we could, really understand how the role of a parent or a teacher would actually change in coming time. So let's understand it in a way that, children were sent to school so as they could have a structured routine or a schedule, and they could learn a lot of things from the school, like social interaction or sharing things with other. In general, they were sent to school to build up their character, in a way. But because of pandemic, the school has actually come to the home, and more of homeschooling is happening. So a lot of pressure, a lot of responsibility now comes on the parent. So my first observation during this COVID pandemic time was that the parents have to manage a lot of things now. They are playing multiple roles right now. I would not say that they were not playing these roles earlier, but right now the problem is that these roles are overlapping on each other. So for example, if a parent was a teacher or a manager or a chef, so the role of that particular responsibility was taken care at a particular time, but now everything is happening at the same point of time, at the same place or a space. So the parent has to play a role of a parent, a role of a manager for the office. So a lot of work is overlapping, a lot of multitasking is there, which is causing a lot of stress. And why is it so? Because when we have a lot of things on our hand which have to be done maybe at same point of a time, there is a lot of struggle going in our mind, and our performance, our efficiency level goes down. And yes, when that goes down, we need to feel really stressed out. So when I speak to parents, they would say that we don't have time, as sir also, Dr. Sir also mentioned it very clearly, that parents don't have time to interact with the children. And that is so because they are so overloaded with household chores and the other responsibilities. The second observation which I made, and we have a lot of research which would second my opinion on that, that during natural disasters or pandemic, the level of domestic violence, substance use, abuse, child neglect, fights at home, violence at home, they reach a peak. They are at high, they are at rise. And therefore children who are there in that environment, are actually very observant of what is happening. And even the families which are at the edge, maybe which are at that borderline of falling into domestic violence or any sort of a negative sort of a thing happening at home, actually get into it. So the children are observing everything. They are there. There are research which say that even a 1 year old can really make out what is the expression of a parent, non-verbal expression of a parent. So imagine a child continuously observing a sort of a violence or domestic violence happening, or hitting happening, or any alteration, even verbal in nature, even non-verbal things happening around which are negative in nature. Will the child be able to really study? That is my question. So the readiness or the actual paying attention to the online classes would be hampered, and child will not study at that point of time. So what needs to be done? What needs to be added as a role of a parent right now at present in the pandemic situation, and maybe later on after pandemic, would be one simple thing I would say, that is they need to take care of their psychological well-being. They need to, parents, I had been advocating this for years, that the parents have to look after their own stress, their own pressure. They can't be ignoring it, and especially at these times they have to be going ahead, seeking help, talking to people, having conversations about it, attending webinars like this, where we could share a few tips for them how they can manage their stress level and handle it in a wise way. Secondly, which Dr. Kapoor also mentioned it very clearly, that anxiety issues are there high in the parents and the children. So maybe that sort of an interaction needs to be looked at, that what interaction is happening at home, what message are we giving the children. And thirdly, parents now maybe have to shift their focus from learning to more of a social interaction, which is now very limited. So they have to push their children for interacting with somebody, maybe a cousin, maybe a family member, maybe a distant aunt, or somebody that is required. Not taking much of the time, I will also try to focus a little more on the second stakeholder, which plays a very important role in a child's life, that is the teachers. So the role of a teacher, I'm sure if we have teacher in the participants, they would totally relate to it, has drastically changed. Every day is a new learning for them. Every day they have to learn a new skill set during this pandemic period, because they are flooded with ample websites, learning platforms, resources. And at times these teachers would take all this as a sort of a demand being put on them, and which leads to burnout. Because we need to understand, in our traditional B.Ed or in our traditional education, we were not taught how to handle these online or virtual online classes. It is something which we have learned. And as a human, we tend to learn things faster, but it actually takes time to execute them. So we are expecting a lot from the teachers right now to, use them in the normal classroom level. The second observation which I have made, and I'm sure slowly a lot of people are now talking about it, that we need to understand that the classroom rules have actually changed. The classroom rules have changed drastically over a pandemic period. The teacher, if she wants to understand if there's any misconduct happening online, she has to be net literate enough to understand that. So if she's not, there's going to be a major problem in the classroom. So these two observations I made during the pandemic. And why I'm mentioning all that, you will be wondering, and we are discussing about health here, why is she talking about all that? But the point is, all this is directly relating to the health, because the psychological well-being of a child, of the stakeholder, plays a ample and a very very important role for a overall development of a child. So the role of a teacher also has drastically changed. So I would say the one thing which needs to be added to the role of the teacher would be that they need to become little more open minded. They have to be more on a growth mindset rather than a fixed mindset. And they should look at this opportunity as a golden opportunity to learn new skill set and try using them. In doing that, there would be a lot of pressure on them. And the same thing which I suggested for the parents, they also have to look after their psychological well-being. They need to talk to people, they need to develop resilient skills in them, so as the stress level can be managed. And when they are dealing with the children, they can deal with the children in a very in a balanced way, so as they are able to impart education plus talk about the health, psychological well-being of the children. So I would like to, end my input into this here, and I'm looking forward to Q&A session, and I'm open for any questions if they are there. Thank you so much.
Thank you so much, Pam. You have correctly said that school is a place where we send our children just for overall development. And also we send them for socialization. But due to everything has changed to, to a digital platform, we are facing a lot of problems. Students are not able to interact with their classmates. Students are not able to interact directly to their teachers. And that is ultimately changing their behavior. And I just really like one of your points that you have to, means the parents have to shift the point of learning to social interaction, because the major part which we all are missing is the social interaction, and that affects our behavior very much. Thank you so much for all those points. I
Welcome,
guess
ma'am.
Ms. Prajakta has been back. So I would like to welcome Ms. Prajakta. Uh,
Hi, good evening, all.
Good evening, ma'am.
Yeah, I think I missed something. Am I?
Yes,
I'm sorry.
ma'am. I would like to welcome you for the session. And I want to introduce Ms. Prajita Gautam. She's the president of Delhi Parents Association. She is committed to reinforcing positive feelings and behaviors in children and parents to help them lead a healthier and happier lives, and mentor parents and family members to tackle with different situations. We are glad to have you here, ma'am.
Thank you, Pooja. Thanks a lot. And uh, thank you for inviting me here in this seminar. And I think it's a very good platform where people can listen and understand the parents' problems as well, which is more important nowadays. Like just Miss Pooja said, or the Mr. Dr. Kapoor, sorry, Dr. Kapoor said, uh, आज आज जो है जो सिचुएशन हो रही है पेरेंट्स के साथ, उनको घर संभालना है, साथ साथ बच्चों को भी संभालना है. एंड वेरी करेक्टली सेड बाय मिस पूजा कि नॉर्मली जो बच्चे होते थे वो 6 आवर्स 7 आवर्स वो स्कूल चले गए, 7 o'clock और 8 o'clock तक वो आप स्कूल पहुंच गए. दे यूज टू रीच बैक अराउंड 2 or 2:30 और 3 o'clock. वो 5-6 घंटे का जो टाइम होता था वो बच्चे बाहर निकल गए. उसके बीच अगर इन केस हस्बैंड वाइफ में कुछ भी आर्ग्यूमेंट होता है तो वो एक होता है ना कि आप उसी टाइम सेटल हो गया. बट लास्ट 6 months में आई डू एग्री इस टाइप के केसेस आप लोगों के पास डेफिनेटली बड़े होंगे. बट more important thing is that what parents should do, how they should take care of their own anger, anxiety. Like Miss Pooja said, I really like those points जो उन्होंने mention किए हैं. उन्होंने mention किया their own stress, they need to focus on their own stress. Of course पेरेंट्स को अपने खुद के स्ट्रेस पे भी ध्यान देना होगा. रादर वो अपना जो स्ट्रेस है वो बच्चों के ऊपर, जिसको बोलते हैं ना अपना गुस्सा बच्चों के ऊपर निकाल देना, जो पुराने मेथड में भी होता था कि पेरेंट्स के साथ होता था, गुस्सा आया किसी पर निकाल दिया बच्चों को. यस, उनका ध्यान रखना चाहिए, वो बच्चों पे नहीं निकालना चाहिए. उनको खुद का ओन जो एंगर एंग्जाइटी चल रहा है, why this own anger and anxiety other than their own लाइफ इश्यूज जो हस्बैंड वाइफ में हुए या कुछ भी हुए, इसके साथ साथ पेरेंट्स एक इनविजिबल इशू से फेस कर रहे हैं, विच इज बेसिकली मींस इट इज देयर अर्निंग फैक्टर. आज की डेट में जो सबसे बड़ा एक पेरेंट्स के साथ प्रॉब्लम आ रहा है कि कहीं ना कहीं उनकी अर्निंग इफेक्ट हुई है. वो पर्सनली व्हाट आई फील दैट इज द मेजर फैक्टर कि वो अपना जो स्ट्रेस है, एंग्जाइटी है या कुछ भी है, एंड इनफैक्ट मैं इसको रिलेट करती हूँ वो क्योंकि उनका अर्निंग इज नाउअडेज इज लेस. whatever is the reason, मीन्स उनका या तो जॉब चला गया या उनका बिजनेस नहीं है. आज की डेट में भी ऑल आर अवेयर अबाउट दिस थिंग कि पैंडेमिक में हार्डली कोई शॉप खुला है, बिकॉज पेरेंट्स में तो हमारे पास बहुत अलग अलग तरह के पेरेंट्स है. कोई बिजनेसमैन है, कोई जॉब करते थे, कोई प्राइवेट में थे. तो सबके साथ में जो नक्शल में प्रॉब्लम ये आ रहा है कि उनका जो अर्निंग है दैट इज अराउंड 20 to 30%. Now they are facing, definitely I agree, they are facing their financial problem, but yes, हमारे पास जो केसेस आते हैं लाइक मी, हम पेरेंट्स को भी काउंसिल करते हैं. आई एम सॉरी डॉक्टर्स, आप लोगों के थोड़ा सा रिस्पॉन्सिबिलिटी हम लोगों ने ले लिया है, बिकॉज नॉट ओनली दी मीन्स स्कूल्स के साथ जो हमारे इश्यूज चल रहे हैं, बट व्हाट आई पर्सनली फील एज ए मदर एज वेल कि हमें बहुत स्मार्टली अपनी सिचुएशंस को हैंडल करना होता है. रही बात बच्चों के साथ सेटल करने की, तो मेरे को ऐसा लगता है, जो पर्सनली मैं भी मानती हूँ और जो हम अपने पेरेंट्स को भी सजेस्ट करते हैं, स्पेंड क्वालिटी टाइम विद योर किड्स. दैट्स अ थंब रूल. अब क्वालिटी में क्वांटिटी नहीं देखा जाता, प्लीज ध्यान रखें. क्वालिटी में क्वांटिटी में इसलिए कह रही हूँ, आप ये कहते हो 1 घंटा 2 घंटा, नहीं. अगर आप 10 मिनट भी अपने बच्चों के साथ स्पेंड करते हैं, प्लस वी ऑल आर अवेयर दैट ड्यू टू दिस पैंडेमिक, ऑब्वियसली हम इतनी देर से यही बातें कर रहे हैं, 6 आवर्स के लिए बच्चे जब बाहर जाते हैं, एक पीयर ग्रुप होता है, एक पीयर फैक्टर होता है, जब अपने एज ग्रुप के बच्चों के साथ अपनी सारी फीलिंग्स शेयर करते हैं. प्लीज लेट देम डू. उनको क्लासेस अटेंड करने के बाद भी अपने दोस्तों से बातें करने दीजिए. आई एग्री, बहुत सारे पेरेंट्स हैं, हम लोग भी बोलते ओवर हर चीज का बुरा होता है. लाइक हम बात कर रहे हैं यहाँ पर ऑनलाइन क्लासेस में जो स्क्रीन टाइम कम करने की, बट आप पेरेंट्स को यहाँ एक चीज समझना होगा, कुछ चीजें ऐसी होती हैं कि जो बच्चे होते हैं पेरेंट्स के साथ शेयर करते हैं, कुछ शेयर और एंजॉयमेंट उनकी अपने पीयर के साथ होती है, अपने क्लासमेट्स के साथ होती है. मैं सिर्फ ये कहना चाहूंगी, डोंट स्पॉइल देयर बचपन, लेट देम प्ले आउटसाइड. आज की डेट में बहुत लिमिटेड हम बच्चों को भेज रहे हैं. हमने फिजिकल एक्टिविटी भी बंद कर दी है. आई एग्री, जैसे डॉक्टर कपूर ने बोला, डेफिनेटली आई एग्री सर, कि यहाँ पर बच्चों के बहुत सारे फिजिकल प्रॉब्लम आना शुरू हो गया है. आई डू एग्री ऑन दिस पॉइंट कि उनमें हेल्थ इश्यूज आ रहे हैं, बट ये सारे इश्यूज तब आते हैं जब अपने आप को, बीइंग अ डॉक्टर आपको ज्यादा पता है, अपने आप को ज्यादा स्ट्रेस पे लेकर आते हैं. बच्चों को स्ट्रेस आउट करने के लिए फ्री छोड़ दीजिए. इनफैक्ट आप मुझसे पर्सनल पूछे, व्हाट आई एम डूइंग इज, लाइक माय डॉटर इज इन 12th क्लास, उसकी क्लासेस होती है मॉर्निंग में और लेट इवनिंग में, बीच में 1 or 2 आवर्स मैं उसको बोलती हूँ कि आप, मैं इनफैक्ट फोर्स करती हूँ, आप कुछ भी करो, अपना जो भी आपको पसंद आए. आपको गिटार बजाना है गिटार बजाओ, शी इज हैविंग हर यूकेलेली आपको करना है करो, जस्ट स्ट्रेस आउट. शी कैन हैव, बच्चों के पास बहुत सारे वेज होते हैं, बट आपको उनको एक्सप्लोर करके बताना है. ये पर्सनल चीजें हैं. मैं 1-2 घंटे का रिलैक्सेशन मैं चाहती हूँ बच्चा ले, क्यों वो स्ट्रेस आउट हो जाता है. माय सन, ही इज इन 8th क्लास, अगर उसको अपने फ्रेंड्स के साथ, आज भी अभी भी आई एम हियर इन दिस टाइम आई एम अटेंडिंग दिस वेबिनार, माय सन इज बिजी विद हिज फ्रेंड्स. तो मतलब आप मुझसे पूछिए कि उनका वो फ्रेंड सर्कल मैंने नहीं जाने दिया. तो सेम चीज व्हाट आई एम एक्सपेक्टिंग पेरेंट्स, कि प्लीज डू नॉट आस्क योर किड्स कि ठीक है स्कूल के आवर्स के बाद जो भी तुम्हारा क्लास हो गया उसके बाद बिल्कुल खत्म कर दो, कंप्यूटर्स बंद कर दो, मोबाइल्स बंद कर दो. प्लीज डोंट डू दिस. आस्क देम टू इंटरेक्ट विद देयर फ्रेंड्स, पीयर, जिनसे भी बात करना है वो बात करें. लाइक ये बहुत जरूरी है, कम्युनिकेशन उनका होना चाहिए. व्हाट आई पर्सनली फील्स, ये बच्चों के स्ट्रेस को डेफिनेटली कम करेगा. यस, पेरेंट्स का रोल इसमें है, थिंक पॉजिटिव, क्योंकि हमें अपने अवेलेबल रिसोर्सेज से निकालना है. whatever is available with the parents, मे बी एक्स के पास ज्यादा रिसोर्सेज है, वाई के पास कम है, बट हमें ये मानना होगा whatever the resources they have, उनको उसी उसमें रहकर अपने आप को करना है. और इंस्टेड के बच्चों पे गुस्सा निकालें या अपना कुछ भी करें, इट इज बेटर. जैसे हमें पुराने जमाने में सिखाते थे कि अगर हस्बैंड वाइफ में भी झगड़ा हो, कमरे में बैठ के अपना कर लो, बाहर आके बच्चों के सामने डोंट डू दैट. ट्राई टू डू दीज थिंग्स, जिससे आई एम श्योर, जैसे मिस पूजा ने भी मेंशन किया कि घर में जब थोड़ा बहुत ऐसा टेंशन रहता है तो बच्चों पे इफेक्ट पड़ता है. आई डू एग्री. बट अगर आप अपना होता है, बहुत सारी चीजें आप बच्चों से छुपा भी नहीं सकते. ऐसा नहीं है कि वो एक ही छत के नीचे रह रहे हैं, आप उनको इग्नोर करो. नो, you can avoid those points in front of kids. ये छोटा सा टिप है. तो मुझे ऐसा लगता है कि पर्सनली बिकॉज अक्सर हमारे पास ऐसे क्वेश्चंस आते हैं, हमारे पास भी इश्यूज आते हैं. प्लस मोस्ट इम्पॉर्टेंटली व्हाट आई थिंक कि पेरेंट्स को और बच्चों को एक मेडिटेशन करना चाहिए, दोनों को आज की डेट में. दैट इज माय पर्सनल एक्सपीरियंस. और मेडिटेशन आपको पूरा फुल टाइम नहीं कर सकते. जब भी आपको एंजाइटी हो, जैसे पहले भी कोई भी बताते थे कि आप आंखें बंद करके 10 काउंट कीजिए, आप गुस्सा हो रहे हो कुछ भी हो, वो काम डाउन हो जाता है. ये दीज आर द स्मॉल थिंग्स अगर आप अपनी डेली की प्रैक्टिस में लेकर आते हैं, व्हाट आई पर्सनली फील कि आप अपने बिहेवियर को कंट्रोल कर लेंगे. नॉट ओनली द पेरेंट्स, आप यही चीज आप बच्चों को समझा सकते हैं. तो दीज आर द सम पॉइंट्स जो मैंने अपनी तरफ से कोशिश की है बीइंग अ रिप्रेजेंटेटिव ऑफ पेरेंट्स, क्योंकि हमारे साथ बहुत सारे पेरेंट्स हैं, ना सिर्फ दिल्ली के पेरेंट्स हैं. वी आर गेटिंग कॉल्स फ्रॉम ऑल ओवर इंडिया. डिफरेंट स्टेट के पेरेंट्स में हमें अप्रोच करते हैं. एंड नाउअडेज वी ऑल आर अवेयर द काइंड ऑफ प्रेशर पेरेंट्स आर फेसिंग. स्पेशली हियर वी आर ऑन दिस प्लेटफॉर्म वेबिनार में प्राइवेट स्कूल से रिलेटेड बहुत सारी चीजें हैं. आई डू एग्री, प्राइवेट स्कूल्स भी उसको फेस कर रहे हैं, हमारी पर्सनली टीचर्स बहुत ज्यादा फेस कर रही हैं. एंड मोस्ट इम्पॉर्टेंटली पेरेंट्स के लिए इस प्लेटफॉर्म में जस्ट मैं ये कहूंगी कि टीचर्स के साथ प्लीज डू नॉट आर्ग्यू, प्लीज डोंट डू दैट. हम लोग उसको प्रेफर नहीं करते हैं बिकॉज दे हैव देयर ओन रिस्पॉन्सिबिलिटी जो उनको स्कूल मैनेजमेंट के कहने पर फॉलो करना पड़ता है. सो प्लीज, क्योंकि ये मैं स्पेशली यहाँ पे इसलिए मेंशन करना चाहती हूँ बिकॉज आई कैन सी, आई थिंक मेनी टीचर्स आर आल्सो हियर. तो टीचर्स यस हमारे लिए हमेशा से गुरु रहे हैं, उनको गुरु मानिए और आप उनको रिस्पेक्ट कीजिए. जब आप उनकी जगह पे जाके देखेंगे तो आपको पता चलेगा द काइंड ऑफ प्रॉब्लम्स टीचर्स आर फेसिंग. आज की डेट में बच्चे तो फिर भी टेक्नोलॉजी से रिलेटेड, दे आर वेल वर्स्ड विद द टेक्नोलॉजी एंड द इक्विपमेंट्स, बट द वे टीचर्स आर डूइंग दैट इज रियली अप्रिशिएबल. वो जिस तरीके से अपने रिसोर्सेज को यूज करके ऑनलाइन क्लासेस दे रही हैं, सब कुछ कर रही हैं. तो माय पर्सनल रिक्वेस्ट सभी पेरेंट्स से जो भी यहाँ पर है, प्लीज डू नॉट आर्ग्यू विद योर टीचर्स. एंड प्लस टीचर्स से भी है कि कभी भी कुछ इन केस रहता है, एक पॉइंट यहाँ पर मैं जस्ट इसलिए कहूंगी क्योंकि बच्चों की टेंशन का एक चीज और हो गया. जब वेबिनार में होते हैं तो एक साथ होते हैं हम 40, 50, 60 बच्चे होते हैं. जब टीचर्स उनके साथ इंटरेक्ट करती है, कभी कभी होता है कि क्लासेस में मैम ने एक बच्चे को डांट दिया, हो सकता है अलग से ले जाके डांट दिया, बट वेबिनार जो बच्चों की वेब क्लासेस हो रही हैं उसमें नहीं हो पाता. बाई चांस टीचर्स का वो गुस्सा या कुछ भी चीज होती है डायरेक्टली बच्चे पर निकल गया. प्लीज आप लोग भी ट्राई कीजिए 1-to-1 बच्चे से कांटेक्ट करके 1-to-1 अगर आप बता देते हैं. मुझे ऐसा लगता है इस पैंडेमिक सिचुएशन में हम सब मिलके इस सिचुएशन को आराम से हम लोग बाहर निकल सकते हैं. ये कोई ऐसी बड़ी चीज नहीं है, जस्ट हमारा दायरा कम हो गया. हम स्कूल के क्लास से निकलकर हम एक सिस्टम पर आ गए हैं. हम 12/14 का जो हमारा लैपटॉप ले लीजिए या 3/6 का मोबाइल ले लीजिए, ये मेरा क्लासरूम बन चुका है, नथिंग एल्स. और दैट्स इट. आई थिंक आई हैव मीन्स मैंने पेरेंट्स का जो सारी चीजें प्रेजेंट भी कर दी हैं और उनसे भी आई थिंक आई एम डन विद दिस. थैंक यू ऑल. थैंक यू.
Thank you so much for your insights, ma'am. I really agree that staying at home has increased the stress level. आपने बहुत अच्छी तरह से हमें समझाया कि हमें कैसे new ways लेके आने चाहिए to cope up this situation and guide our children to engage in some other activities. जैसे कि आपने बहुत अच्छी तरह से एग्जाम्पल लिया अपने डॉटर का कि अगर हम बाहर नहीं जा पा रहे तो हमें गिटार बजाने देना चाहिए. That and these activities help children to be engaged and also decrease their stress level. Thank you so much. Now we are open for Q&A round. I would request the participants to please post their question with the name of the panelist in the Q&A box. My first question is for Dr. Kapoor. One of the participants has asked, what is the most important health related knowledge which should be imparted to children from a young age?
As far as young age is concerned, we should start right, I'll say, from the time when baby is even 1 year old. Issue over there is again, but education. Education is just not verbal education. Education is my behavior, is my tackling of the emotions. As one of the panelists, Pooja, was talking, that children understand the emotion of the parents. I always say that they're garbh sanskar. Even the mother's emotions, they get passed to the children while baby is in the womb. So please manage your emotions. I would like to give an example of aeroplane. When air hostess tells you that put on your mask first, then think of the mask, putting on the mask of your person who is sitting beside you. So the teaching starts right at the time of birth and 1 year. Please be a very, very systematic manner and don't be a dysfunctional family. Manage your emotions right at the time when baby is understanding your emotions. Connect with him, connecting with the child. Understanding the emotions is very important. So those are the issues which are very important. But you talk the issues which are very, very prominent issues about the health issues. I will come to the diet part. I will come to the hygiene part. The two key issues which we should always talk to the children. If we start taking diet, which is junk food, how can we really tell a child to not eat that? I always believe that all our habits that get transmitted to our children, the way we behave, let it be junk food, let it be hygiene, even I will say, the way we cough, way we sneeze, the way we wash our hands, everything the child is imbibing day in and day out. So the two key issues for the child, I will say, is dietary issues and the hygiene issues. Definitely, as the child grows, the issues keep on changing. The developmental issues like making friends and choosing the right friends. And again, I will say, okay, touch which is okay and touch which is not okay. Even it start very early. Because once we are giving that liberty to the child, so one of the panelists was talking about even social media. I will say, let's share the social media time also with the our children. Each minute in the social media can also be a teaching time, I will say. You can always discuss the issues with your children, whatever they're saying, whatever they're interested in. Okay, why are you liking it? Why it is not being liked? Every small issues can be touched. But again, media time has to be limited, has to be a media plan in the house. Like this time will be the media time, this time won't be the media time. So that's a very important issue. But coming to other issues, people were talking of the participation. In this COVID time, we need to participate in the activities of our children, I will say. It's not reverse. Let's participate in their activities. Once they are into physical exercises, when time is fixed, I will do physical exercise with my son. That's time which is to spend together, the connectedness. He should feel connected. That look, we are doing it together. What are we doing? Even if he puts on the media, the dance media, and start dancing, we also come. Okay, that's a physical exercise for us. Let's dance together. Let's sing together. So all this time we need to work together. That's also a health issue, the physical activity issue, which we talk about this. And I've already talked about. Again, I will emphasize the good touch or bad touch. I won't say the good touch. I will say touch which is not okay, touch which is not good should always be told to our children, because that's an issue which social media is trying to really, really harm our children. So we need to be together with them. We should talk about this. If you talk about hygiene, ultimately you're going to come to the corona, you're going to come to the other diseases. If you talk about diet, you will talk about NCDs also. And coming to the psychological issues, which are the key issues which are being raised by other panelists, I will say again, we need to adapt first to our emotions. We need to control our emotions, and then only we can talk about the emotions of the children. Even I will say that even we are not able to name our emotions, what emotions I am going through, how to control it, and what other activities we can do it. And again, it's just not adapting to these emotions. The key issue over here is diverting. The children and parents should divert to other activities. Even cooking the food, I will say. Why can't we cook food together? Children should be made to do that. Small things they can do it. Look, you do this, I will do this. And give them that to it. You have participated into this. Even I will say, some days before there was 15th August, we all went on the rooftop and tried doing kite flying also, but taking all the safety precautions. So all these issues, the safety issues, the dietary issues, the hygiene issues, and ultimately the psychological issues need to be taken care of by our parents. And teachers have played a very big role. I will always say that teachers are the role model. Sometimes students and children, they don't take the parents' words as the last word. They take teachers as the ultimate people who can teach them. So teachers have a very big role to play. Even they are coming online classes, they listen to them more intently than they listen to the parents. So let's teachers also be totally tuned to that this time we have the key issues of health. And if they talk about their health issues, they will definitely, children will definitely listen to them. And we should keep asking our children, what has teacher taught it to you? And assess, ask the teachers also, what is your assessment about my child? Is he performing well? Is he learning well? All the health issues. So teachers, I will say again, a very big role to play in health issues as well, because the ultimately is not only teacher to child. If the child learns from a teacher, this message, the child becomes ambassador. He will send this message to 10 more friends, peers. That's a peer-to-peer education group which forms. So teachers, please, if you take lead into this, teach our children the right health practices, health behaviors that will get transmitted to 10 more children who are their friends upon on the social media. So teachers also have a very big role to play. Anything more, please let me know.
I totally agree, sir, that parents and teachers both play an important role in child's life, that even the parents have to participate. If parents participate each and every
But look, the word of teacher spreads. The students see the word of teacher with such a big importance. My teacher has told you this, and they will transmit this message to 10 more children. If this should be done, this my teacher has told you this. Because parents are there
yes,
every day, but teachers come to
yes,
1 hour, 2 hours, and their words are gospel speak for them.
yes, I totally agree. Because as I said earlier also, teacher has always been a guideline spark. So my next question is for Miss Miss Pooja. Puneet from the audience has asked how to ensure a good personality development of children in the present times during the corona times.
All right. So, first of all, I would, like to explain one thing, that the personality development of the child was also happening before the corona, and similarly, it will happen in the same way in during and maybe after the corona also. The difference is that everything now comes on to the parent. As I had started, with my session, that we used to send children to the school for their character development, for them to learn few soft skills, few skills where they used to learn to share, follow a structure. Now a lot of responsibility comes onto a parent, now. So what parents can do to develop a better personality or to have a better characteristics in the children, first thing would be that you all have to understand, and it is for us also, that we have to have some routine in place. I know parents, I know people, they are having no routine at home. Whenever they feel like, they will get up whenever there is a call from the office, the lights would be switched on, food would be cooked, so there is no routine being followed. When we follow a routine or a schedule, we look forward to the day, and towards the day end, we feel like that we have accomplished something, and we sleep with that sort of a positivity. So for a personality to develop in a better way, the first utmost thing would be to follow a routine. The second would be that, as everybody has been talking in the panelists, from the panelists, that, we need to have some sort of a self regulation. When I say self regulation, I mean that we need to regulate our emotions in a right way. I'm not saying that you don't have to express your emotions. Any sort of emotions, be it positive or negative, are good to be expressed in a right way. right way. When I say right way, I mean if as a kid or as a parent or as a teacher you are feeling angry or aggressive, I'm not asking you to keep it inside yourself and suppress it. You need to figure out ways to express that emotion during this time in the pandemic time. Keeping in mind we are less of space at home, keeping in mind whatever way of expressing of emotion you're using, people will be observing you. If we keep on trying to suppress our emotions, our personalities are directly affected. So maybe things like getting into exercise, breathing, making some gratitude journal, having some activities as a family where you write all the positives which have happened in a day would be a good way of expressing your feelings. The third point, which is very important right now for a personality development of a child, would be reassuring the child, because the kids are at a very high anxiety level. Dr. Kapoor very rightly started his talk with this point that kids are at high anxiety level because the parents are quite anxious. So as a parent, if you are anxious and you are moving around in the house with all stress and that look on your face, and whenever you have to step out of the house you are very worried, and you look very tense, all that is being seen by that kid at your home. I'm not talking about younger kids, I'm actually talking about them also, as well as kids who are around 17 or 15. They are still kids, they are still children, they see what you're going through, and it becomes a quite high anxiety levels for them, and becomes very difficult for them to manage all that. And imagine, will personality develop at that point of time? It will not. So a sort of a reassurance from the parent that we know what corona is, and logically we are following these cautions, and if we keep on following them logically and we don't let our emotions overpower our logical thinking, we will be able to handle this situation in a very better way. And lastly, I think for a better development of a child, the overall environment of the family should be quite positive in nature. Some simple resilience techniques can be followed by both parents and the students, to have student children and teachers to have a very good home environment. So that is something which is quite a good idea to have a better personality development for a child. Yeah, thank you.
Thank you so much for your tips, and it was really motivating. I really like that. Yes, we should follow a routine, and we should regulate the emotions. And gratitude is one thing which we should learn from when we are young, and it will create positivity somehow. So my next question is for Aprajita ma'am. Should we? Hello, ma'am.
Yeah, yeah. Yes,
Can you
yes,
hear
I'm
me?
here. Yes, I'm here.
Yeah. Should we push children to study when they don't feel like studying in this pandemic times?
प्लीज डोंट डू दैट. अगर अगर आपका बच्चा ऐसा कुछ चाहता है, प्लीज डोंट पुश देम. सी, आई एम नॉट अ डॉक्टर, और ना ही मैं कोई स्पेशलिस्ट हूँ, बट एज ए मदर जो मैंने एक्सपीरियंस किया है, द वे आई हैव हैंडल माई सिचुएशंस, मैं सिर्फ उनके बेस पे कह सकती हूँ. छोटा सा आपको एग्जांपल देती हूँ. माय सन वाज ओनली 3 and 3.5 years old. उसको स्कूल में कुछ ऐसा इशू हुआ, तो वो स्कूल नहीं जाना चाहता था. तो आप जनरली बिलीव नहीं करेंगे, नॉर्मली पेरेंट्स इतना बड़ा स्टेप नहीं लेते. हमने इमीडिएटली उसको स्कूल से निकाल दिया. ट्रस्ट मी, हमने अपने बच्चे को स्कूल ही नहीं भेजा. क्यों? क्योंकि मेरा सिर्फ एक अपने आप में ये था कि इन केस बच्चे को जो डर है स्कूल ना जाने वाला जो है, कि उसको नहीं जाना, वो अगर उसके दिमाग में बैठ गया, वो बड़ा होने के बाद भी नहीं जाएगा. फॉर अनदर 6 months और 1 year हमने उसको घर पे रखा. वो ऑब्वियसली माइन इज जॉइंट फैमिली, तो हम लोग सारे मिलके खेल रहे हैं, कुछ भी उसके साथ इंटरेक्ट कर रहे हैं. आफ्टर अ ईयर हमने उसको पूरे 1 साल के बाद हमने उसको स्कूल में डाला. बट आई डू एग्री कि बड़ी क्लास में आपको जाके ऐसा नहीं हो सकता. बट लेट्स से आज भी अगर मेरा बच्चा अगर पढ़ने में इंटरेस्टेड नहीं है, तो देखिए, मैं बहुत बड़ी बातें नहीं कहूंगी, बहुत प्रैक्टिकल एस्पेक्ट्स आपके साथ शेयर करती हूँ. तो मैं 1-to-1 इंटरेक्ट करके बच्चे का मूड स्विंग जान लेती हूँ. हाँ कि भाई मूड स्विंग हो रहे हैं, वो पढ़ना नहीं चाह रहा. क्यों नहीं पढ़ना चाह रहा? इच्छा नहीं है. इच्छा नहीं है, कोई बात नहीं. मैं सीधा बोलती, कोई बात नहीं, बुक्स बंद करो, मस्ती करो. ट्रस्ट मी, अगर पेरेंट्स उनके फ्रेंड बन जाते हैं, आप थोड़ा सा मिच्योर बिहेव करते हैं, पेरेंट्स फ्रेंड बन जाते हैं, आपकी हाफ दी प्रॉब्लम खत्म हो जाएंगे वहीं की वहीं। रही बात बच्चे के पढ़ने ना पढ़ने की, आप प्रैक्टिकली अपने ऊपर भी लगा के देखिए, पेरेंट्स भी, हम लोगों में भी होता है कई बार किसी काम को करने का बिल्कुल मन नहीं कर रहा था, सो प्लीज डू नॉट फोर्स योर किड्स कि नहीं वो बैठे एक जगह बैठ के पढ़ें। आई नो रूटीन सेट करना, सिटिंग हैबिट्स होना एक चीज अच्छी होती है, जब तक वो खुद से नहीं आएगी, बच्चे के ऊपर आप प्रेशर डालेंगे, आप अननेसेसरली बच्चे को प्रेशर डालने के लिए आप एक तरह से उस पर प्रेशर डाल के उसको ज्यादा आपको टेंशन देंगे। और ये भी मान के चलिए, कोई भी जो जितने भी बच्चे हैं सबका अलग अलग एक्सपर्टी है, आप एक्स बच्चे से अपने बच्चे को आप कंपेयर मत कीजिए। तो अगर आपके बच्चे को इच्छा नहीं है पढ़ने की, फॉर द टाइमिंग उसको छोड़ दीजिए। मैं क्या करती हूँ, मैं आज इस पेंडेमिक में आप मुझसे फ्रेंकली पूछेंगे, मैं नई नई चीजें बच्चों को कुक करके दे रही हूँ, वो एंकरेज होते हैं। बहुत सारे ऐसे इंसिडेंट हुए मैं नई नई चीजें बना के दे रही हूँ, क्योंकि घर में आप बाहर से आप मंगवाते नहीं सकते, नहीं भी मंगवाना चाहिए, हेल्दी फूड इज ऑलवेज बेटर। तो दीज आर सम पॉइंट्स जहाँ पर आप बच्चे के साथ जब 1-to-1 इंटरेक्ट करते हैं, तो मुझे ऐसा लगता है कि यू आर गोइंग टू बिल्ड अ हेल्दी रिलेशनशिप विद योर किड्स, दैट इज मोर इम्पोर्टेंट। वंस जब आपने वो हेल्थी रिलेशनशिप डेवलप कर लेंगे, यू ट्रस्ट मी, पढ़ने वाली बात या ये वाली बात आप देखेंगे बच्चे की धीरे धीरे कम हो जाएगी। आई थिंक दिस इज द बेस्ट वे। ये तो मैं प्रैक्टिकल एक्सपीरियंस में फिर कह रही हूँ, आई एम नॉट एक्सपर्टी लाइक मिस पूजा और आई एम नॉट अ डॉक्टर लाइक मिस्टर कपूर हियर। जो भी मैं आपको बता रही हूँ प्रैक्टिकल एक्सपीरियंस बता रही हूँ, एंड यही चीजें, ये टिप्स मैं बोलूँ, हम अपने पेरेंट्स के साथ शेयर करते हैं, एंड आई एम ग्लैड टू शेयर, पेरेंट्स को रिलीफ भी मिला इन छोटे छोटे प्रैक्टिकल टिप्स से। जी थैंक यू।
Thank you so much, ma'am. And you have all rightly said that we should encourage our children, parents should encourage their children to take up tasks. And yeah, even parents should participate with them, as Dr. Kapoor has also mentioned earlier. So one of the question is for Aprajita ma'am only, that as a parent, what do you feel that school should reopen soon
नो,
or not?
नॉट एट ऑल, नॉट एट ऑल। क्योंकि इसमें मैं आपको बहुत बड़ा एक फैक्ट बताऊं, हम लोग जो देख रहे हैं एक नंबर्स, हम लोग पैंडेमिक के नंबर्स, ये जो कोरोना के नंबर्स हम देख रहे हैं, रियलिटी इससे बुरी है, राइट? एंड स्कूल क्यों ओपन नहीं हो, मैं आपको छोटा सा एग्जांपल बताती हूँ। हम तो ऐसे बहुत सारी एक्टिविटी कर चुके हैं। बीइंग अ प्रेसिडेंट, मैं भी नहीं कहूंगी स्कूल ओपन हो, क्योंकि हमें पता है स्कूल्स आर, दे आर नॉट गोइंग टू फॉलो द एसओपी। प्लस मैं खुद आधा घंटा मास्क नहीं लगा सकते, हाउ कुड आई एक्सपेक्ट माय किड्स कि वो 8 आवर्स मास्क लगाएं, और वो भी अपने पीयर के साथ अपने। और प्रैक्टिकली आप देखेंगे, अभी पीछे राखी गई है, मैं और आप, हम लोग अभी इसमें वेबिनार में बैठे हुए हैं, आप अपना भी सोचिए, 10 दिन पहले 20 दिन पहले जो राखी गई है, क्या आप लोग अपने अपने सिस्टर्स के साथ और ब्रदर के साथ बैठे, क्या आप लोग मास्क लगा के बैठे थे? नहीं बैठे होंगे। सेम आप सोचिए कि बच्चे 1 या 2 दिन ही शायद कर पाएंगे, उसको फॉलो नहीं कर पाएंगे। तो हमें बहुत प्रैक्टिकल एस्पेक्ट देखना चाहिए। रही बात एजुकेशन की, आई नो इसमें जो ऑनलाइन एजुकेशन हो रहा है दैट इज सफिशिएंट। हमें किसी चीज को इतना बड़ा हवा नहीं बनाना चाहिए, हमें सिचुएशन के हिसाब से, जैसे मैंने पहले भी कहा, हमें अपने सिचुएशन के हिसाब से अपनी डिमांड्स को और अपने उन चीजों की सप्लाई देखते हुए भी चेंज करना चाहिए, प्लान, जिसको हम प्लान बोलते हैं, प्लान चेंज करना चाहिए। और स्कूल ओपन होने की बात अगर हम आपको बताएं, नहीं, हम बिल्कुल भी एग्री नहीं है, क्योंकि यहाँ हम सिर्फ केवल, प्लीज प्राइवेट स्कूल्स की बात नहीं करें, जहाँ पे शायद प्राइवेट स्कूल पूरा एसओपी फॉलो करके, पूरा हाइजीन ध्यान में रखते हुए छोटी छोटी चीजों को करते हैं, बट कभी जाके उन सरकारी स्कूलों का भी दौरा कीजिए, या लो बजट स्कूल का भी दौरा कीजिए, जहाँ पे बहुत प्रॉब्लम है। तो वी कैन नॉट प्ले विद द लाइफ ऑफ सिंगल स्टूडेंट इन फैक्ट। तो वी आर नॉट इन फेवर कि अभी इस सिचुएशन में जो ग्राफ जिस तरीके से जा रहा है, कि हम लोग गवर्नमेंट को भी बोलें या हम लोग इसको सपोर्ट करें कि स्कूल ओपन हो जाए। Right, Pooja? Thank you.
Yes, you are rightly said, ma'am. It's too risky to send the students right now, as sometimes the cases are increasing and sometimes the cases are decreasing. So there is high risk of infection. Miss Pooja, do you want to add something?
See, as ma'am has mentioned it very rightly, it's going to be very tricky situation for all of us. In fact, I am more worried about children who are very younger, plus children with special needs. It's going to be very difficult to put it across to them and tell them that how it has to be handled there. And plus, the only issue is the population of our country, I would say, because in each class we have around 45 kids there. So I think it's impossible to get them back to school right now, and it's going to be a very scary situation. And I think US actually tried doing that. I'm not getting into any political thing, but one a particular state tried doing that, and there were number of kids who were infected by corona, because they opened the school, and imagine they had everything planned and still it happened. So I'm sure it's going to be a very tricky situation. Yeah.
I truly agree with you, ma'am. There are a few more questions. So if the panelists don't mind, can we extend the time at
Sure.
least 15 minutes by 15 minutes?
Sure, we can. I'm okay with it.
Yeah, I'm also okay. Uh,
Sure, carry on, please.
Okay, so my next question is for Dr. Kapoor. What would be the major challenges of adaptation of health education faced by schools earlier also and during the COVID times?
I've been head of the school health program. The health education is still not part of the curriculum. If you're talking of health education, otherwise, only of education, the many steps have been taken by the government. New education policy have also come, which you must have all gone through. So I'm talking of health education. The health education is always been taken as an accessory. Students may attend it, teachers may take it or not take it. This is I'm talking of pre-pandemic times. So we have made so many modules, SCRT, NCRT, there's so many modules which are available. But till the time they become the part of the curriculum, nobody takes them seriously. Frankly speaking, students are already so much overburdened by the academic part of it, the curriculum part of it. So they also don't bother. Okay, this is important. Ultimately, I always believe the education is that which helps you in living, which improves your lifestyles, which improves your lifetime spanning. All these things should be part of the learning part. But at this moment, at which age, health education is really put on the sideways. Coming to the pandemic part of it, at this moment, the challenges are too many for the parents as well as students, as well as schools, I will say. Now, once you're saying schools are not going to open, how are we going to give this health education to our students? Shall we approach a hybrid approach? But considering that children themselves, when they get infected by COVID, the symptoms are very mild, but they are super spreader. They can spread this infection to the families. That's what studies have been saying this. So even hybrid approach, calling them half of the class or 1/10 of the class and giving them some session is very difficult time. So the ultimately everything is boiling down to media and social media. But let me also tell you that media has so much of misinformation flowing also over there. So there is somebody has to be there, either teachers or parents who are going to remove this misinformation. And media also sensationalize the thing so much that anxiety levels shoots up rather high than going down. So media is a double-edged sword. We need to have real control. We should only go to those media sites which are authentic, which are government sites. Otherwise, either we are going to land up with the misinformation or we are going to have our anxiety level shooting very high. So, health education is a real big challenge. Even if I say online, Okay, some of the schools are going online and they can give health education part of it. Even Sharp might be doing this also. But how to get the feedback then? Is it just the education part? Is it also a part of the change in the behavior, which is the key important? I'm saying even adults, they are roaming about without masks. You talked about Raksha Bandhan. You talked about other things. I've seen still, I've go to hospitals, people are not bothered. I'm really surprised. They are adults, they are the role models. Even parents have to be the role models for their children. The teachers have to be role models. All adults which are there, with are coming in contact with the role models. So that's a big challenge. One, society is not with me. How are we going to control this epidemic? How are we going to give this health education? Ultimately, let's take the rule of role modeling first. We should all be very, very serious about it. And that's the best message in the pandemic time. If my parents are doing this, I also know. I've seen, look, I'm a child specialist. I've seen even a child who is 9 months old coming with a mask. I was so happy. I've clicked a photograph I can share with these people with a 9 month old child because both the parents was using a mask. And he was asking with Ishara, give me the mask also. I've seen 2 years, 3 years people, children using a mask and then coming out of it. So please, it's a very big challenge, but teachers as well as parents have to become role models. We have to go to the media. Media is the only source till the time when a vaccine comes, which is still seems like to the end of the December or maybe beginning of the January, we will be getting this vaccine, but that will also be very limited amount in the beginning. So we need to create this behavioral changes, I will say. The behavioral issues are the key issues of adults which children is to follow. So come out of this format. I won't get infected. Sab chalta hai. No, even if you have got infected, you have recently had the second infection happening. So please, even if you got infected already, please use mask, please use hand hygiene, use all the etiquettes for coughing and sneezing so that the society is safe from this part of it. But it's a very big challenge. I will solely say for the school as well as parents, because if they are not on my side, Corona is not going to stop. It's going to last for 2 years. And academics, jobs, finances, behaviors, everything is going to get affected, which are already affected, you're talking about. They're going to get affected worse than this if we are not able to change our behavior this very time. Thank you very much.
Thank you so much, sir. Yes, I also agree that there should be behavioral changes. Rather than awareness, we should focus on behavioral changes of students. And my last question is for Miss Pooja Bakshi. What strategies school can impart to promote psychological well-being of students
Right.
during
So,
this time?
okay. So especially during this time, I'll want to share my example. So when we started in March, when it all had happened, it was a major learning for all of us. Okay. In school, it is quite easy for a school counselor to approach the parents and the students and even take care of the teachers' well-being, because you can directly go to them, talk to them, have a session, and it's done. But during pandemic, it was a major task and an uphill task to actually do something for everyone. So as a school, what we can do is we need to look at the well-being of all the stakeholders. When I say that, it's not only the students we should target at, we should also target at teachers, we should also target at parents. So what we have done as a school is that we have started doing workshops. For example, if you're talking about a workshop on time management, so that session is being conducted for the students in groups, plus for the parents in groups, and for the teachers as well. So what are we doing? We're trying to impart some basic skills which are required at this point of time, especially for teachers. Some sessions on working on their resilience level, because as Aprajita ma'am mentioned very clearly, that they are under high stress level. They are learning things and imparting them, and it's very quick in nature, and we need to understand as the age progress, our learning comes, gets restricted, and we become little rigid. For them to unlearn and learn new thing takes time, and they go in a lot of stress. So teachers should be undergoing some sort of positive thinking training, managing their negative emotions and thought processes. I would also say that, there has to be a regular sort of a motivation and encouragement for the teachers from the management side also. A simple message or an appreciation sort of a thing is very helpful. And one more thing which is important is rewriting the school rules. We need to understand that, because we were dealing physically with everything and everything was very clear. Okay, this behavior will happen. Parents were aware, teachers were aware, authorities were aware, but everything is so vague now. If we get, I can tell you, and I'm sure Aprajita ma'am can relate to it. Every day when an online class is happening, there is one silly message which will come up and it will disturb the class. And the teacher is clueless that who has messaged this, where is it coming from. So I would say cyber literacy, and making teachers should go through some sort of a training which should be imparted by the school for the teachers and the parents, because parents are also clueless. They also don't know, what exactly is happening on an online class. They would view it that there's a class going on, whereas the child is chatting over the phone. So everyone needs to have a sort of a upgradation on their knowledge about the cyberspace. And I feel if these workshops for appropriate stakeholders are done and for children are done on a regular basis, that is something which we need to be very sure of. One parenting session happening once a year will not help, or one session happening for a teacher on their psychological well-being will not help. Having one session with a group of children on bullying will not help. It has to be done on a continuous basis, on a regular basis. And I would say, and I would really urge the counselors, look, I think things have also become easier. You have to do a session online. You don't have to move to, classroom to classroom, settle them down. It is little easier, and we just need to be there and start doing it. I'm sure the whole psychological and the well-being of the school will be taken care of, but everybody has to be involved into it. That is the crux of the thing, I would say. Yeah, thank you so much, ma'am.
Thank you so much. I really enjoyed that. It's like that you have also said that yes, we have to rewrite the rules of the schools, and even one session or two session will not matter. There should be a continuous awareness being given to both all the stakeholders, not only the students, not only the parents, but also to the teachers also. And means we have to combine all together, and then only I think we will make this like if we are targeting this children, then only we will do something for the children.
Yeah.
Thank you so much. To conclude the session, I would say that we have spoken about so many aspects today, from mental health, nutrition, diet, and also how school can be a stakeholder who can help the children's well-being, as well as the psychological well-being, and can help the child to grow. Thank you so much for joining us today. I thank all the
My
panelists
pleasure.
for taking time and joining us for the session. I thank all the participants for joining us. Before the webinar ends, I would request the audience before leaving the webinar, I would request the audience to fill this feedback poll. And I once again thank the panelists for taking our time and joining us for the session. I thank all the participants for joining us today.
Thank you so much. Thank you.
Thank you, Sharon.
Thank
And
you,
thank
ma'am.
you, Shah. Thank you.
A few announcements. Your certificates will be mailed to you just after the session. To know about the frequent update of the webinars, please subscribe to our website and follow us on social media platform for the takeaways of the session. And also, STARP is running a campaign for flood relief in Assam. We're distributing dry rations and hygienic kits in the disaster-affected areas. Please support us for the same. Thank you everyone for joining us.
Thank you.
Thank you, Sharon. Thank you so much. Good evening.
Thank you.